All right, we're going to talk about the basic metabolic panel. So metabolism, which is one of the key words in basic metabolic panel, right, is referring to metabolism. Metabolism is simply all of the different chemical reactions and operations going on inside the body. So it's kind of a catch-all term that describes like everything chemically happening within a person. Especially all the things that have to do with like nutrients and food and production of waste and that sort of thing. So a basic metabolic panel as part of a blood test helps monitor specific things within the blood. That could be different nutrients, it could be different waste products. Just kind of getting a picture of like how well the body is metabolizing food, metabolizing different nutrients, vitamins, etc., and taking care of and getting rid of waste as well, right? Just keeping an overall look on the metabolism of the body. So when we are doing a basic metabolic panel, we're going to look at levels of glucose, which is blood sugar. It's the sugar that's dissolved in a person's bloodstream. We're also going to look at blood electrolytes. Electrolytes are like little ionic compounds within the blood. So things like sodium, calcium, potassium, chloride. These all have to do with like how well the body is able to like maintain its water balance and move nutrients around and keep like the nerves and muscles and those sorts of things functioning properly. Ions, electrolytes such as sodium, calcium, potassium, chloride, all really heavily involved in the proper function of like both nerves and nerve cells, brain cells, as well as muscles. And then there is blood urea, nitrogen, and creatinine. So these are waste products we're going to be keeping an eye on. These should be getting filtered out by the kidneys. And so if these levels are high, that could show that there's a problem with the kidneys. So let's talk about each of those in a little bit more detail in turn. So first of all, that creatinine. You can see here the normal ranges. Men, 0.7 to 1.3 milligrams per deciliter. Women, 0.6 to 1.1 milligrams per deciliter. This is, like I said, it's one of those waste products you might find in the blood. So if you have abnormal amounts, that could be signs that there's a problem with the kidneys. Could also be an issue with dehydration. So, of course, one way to have too much of something is to just have too much of it. Another way, when you're looking at concentrations of things dissolved in substances like water, right, is if you're dehydrated. If there's not enough water, if there's not enough blood, and there's not enough plasma in the blood, then all those numbers can look elevated due to dehydration. Could also be that muscles are being broken down. So could be something that gets elevated a little bit like after a workout, but especially if somebody's like working out too hard, or if they're maybe like starving and their muscles are breaking down, or there's something else going wrong with their muscles, they could have too much creatinine. Too little could be a sign of malnutrition, or also just low muscle mass. So this is something that's being produced by the muscles, especially as they're being used and broken down. Then you also have blood urea and nitrogen. Normal levels are between 6 to 20 milligrams per deciliter. Too much, of course, once again, could be a sign of kidney disease or dehydration, but it could also be a sign of heart failure. Now, if there's too little nitrogen in the blood, that could be an issue with the liver, or once again, malnutrition, right? Should have some nitrogen in the blood. Don't want to have too little. Then your different electrolytes. So there's a whole bunch of different electrolytes, little ionic compounds that float around in the bloodstream within the plasma of the blood. And so you can see the normal ranges for all of these: bicarbonate, chloride, magnesium, phosphorus, potassium, sodium. Don't feel like you have to know the normal ranges of any of these things. You can check them, pause and check them out if you want to. But once again, if we have abnormal results of that, we could again be signs of dehydration, kidney disease, heart failure, liver disease, or even high blood pressure. One specific electrolyte that wasn't listed on the previous one is calcium. And calcium, again, something important that you need to have that's really important to your body, really important for the proper functioning of your muscles and nerves especially, and also in the production of your bones. Problems there could be signs of, again, kidney and liver problems. Could also be a problem with bone disease, maybe the bones being broken down unnecessarily. Could also be thyroid disorder, or even cancer, in addition to malnutrition like we've seen on some of the other ones. And then finally, we have glucose. Once again, this is the sugar that we find in the blood. It is the main source of energy for the cells. The blood sugar, that glucose blood sugar. Normal range is between 70 to 99 milligrams per deciliter after 8 to 12 hours of not eating. So that's like a fasting amount. Like oftentimes if you need to have blood work done, they might ask you to fast and not eat anything prior to having that blood drawn. And if you have too much glucose, that could be diabetes or pre-diabetes, which could indicate that it could develop into diabetes. Too little will be hypoglycemia, basically not enough blood sugar. So there's a quick overview of the basic metabolic panel and the different things in there, and what high levels or low levels of these various things might indicate.